Hamza Mohammed from Gem 4. Today we will discuss about diabetes mellitus, how diabetes mellitus cause abnormality in our body, what is the reason behind that our body does not store glucose or does not produce enough insulin or may produce less insulin. So first of all we have to know about what is diabetes mellitus. It is commonly known as diabetes, and it is a actually diabetes mellitus is a metabolically disease that causes high blood sugar level in our body. So what happened actually, the hormone insulin which is produced by pancreas, the main function of insulin is move glucose from blood to cell in normal condition. What happened that insulin bind with receptor on target cell, and these target cell trigger signaling cascade which initiate the glucose and transport the glucose to the cell membrane. So but in normal condition, in unfavorable condition, what happen, the insulin does not bind with the receptor and does not activate or trigger signaling cascade which cause the abnormality in our body, or it cause the low glucose in our body. So what is the purpose, that if insulin bind with our with the receptor, so everything will be normal, but when insulin does not bind with our receptor, so it means that the glucose is not transferred from blood to our cell. So that is the main background of this disease. So the main symptom which is involved in diabetes mellitus are unexperienced weight loss, increase hunger, increase urination, dehydration, and excessive thirst will include in the symptom of diabetes mellitus. Now we will move to complication. We will talk about chronic complication and acute complication. What is a chronic complication? If a patient have high insulin in his blood, that if a patient has high insulin in his blood, the following symptom or the following complication may cause in his body. So first of all, we will talk about cardiovascular diseases such as heart attack and stroke, and secondly vision loss. Our eyes nerve, especially the nerve of our eyes, does not work properly, due to which our eyes vision will loss. Secondly, renal failure, the kidney does not proper work properly due to diabetes mellitus. It may cause abnormality and nerve damage and also impair wound. These are the complications involved in the chronic diabetes mellitus. Now we will move to acute complication. If a patient is if the patient of diabetes mellitus is in high stress during its during in this disease, so the following complication may occur, such as infection and pneumonia and UITs, and such as cardiovascular disease, as we talk about in chronic condition. And third one is individual diabetic treatment. So these are about complication, chronic and acute. Now we will talk about, and most important, that what are type 1 and what are type 2 diabetes. Has been known there are two types of diabetes mellitus, that are type 1 and type 2. So what is type 1? In type 1, the beta cell of pancreas does not produce or eat the beta cell may be destroyed by our own body system mistakenly our own body system destroy the beta cell of pancreas. So during type 1, as we know that beta cell are destroyed. And secondly, in insulin production reduce and less insulin bind with insulin receptor. And third is less glucose transfer from blood to cell. uh, and the symptom of type 1 is rise or appear in the age of 20. and these type 1 disease may be treated by the can be treated easily by replacement of insulin or managed by insulin injection. So, what is type 2 diabetes? In type 2 diabetes, enough insulin is produced to perform their function, but something is wrong in receptor insulin binding receptor and synchrin cascade. So, what happened? The cell do not respond to insulin. The synchrin cell, the insulin receptor, do not respond to insulin that bind with um, receptor. So insulin does not bind with receptor, and glucose does not transfer from blood to blood to cell. So in diabetes, in type 2 diabetes, insulin is produced enough to perform their function, but the main abnormality occur in the synchrin cascade and the receptor binding cell, due to which the insulin and due to which the glucose cannot transfer from blood to glucose. And type 2 disease is type 2 diabetes are insulin resistance, and the main symptom are the type 2 diabetes symptom appear in the age of after the age of 30. So that is all about the diabetes mellitus. And